everyone, and for today's video, I will going to do the integumentary assessment. But before anything else, we should wash our hand first before doing the assessment and inform the patient what are we going to do with her and make sure that the patient is comfortable. In doing the integumentary assessment, we are focusing on hair, skin, and nails. So next is ask your patient if she is suffering from any problems of skin like rashes, dryness, oiliness, bruising, open sores, itchiness, any birthmarks or moles, any change in the ability to feel pain, pressure, or temperature. Also ask the patient if she feel any numbness or tingling, trouble controlling body odor, or any tattoos or piercings. So the first assessment that I'll perform is the hair assessment. In doing the hair assessment, we should inspect and palpate the skin. Can you hold this for me, please? So this is how you're going to inspect and palpate the skin. We should section each hair, and we should separate each hair to inspect and palpate the hair scalp. Since I don't have any Q-tip here, I'll be using a stick to section and separate the hair of my patient. And this is how you're going to section and separate her hair. Like this. What we are looking here is any intact skin, lesions, and needs. We are also palpating the texture of the hair, if it is moist, soft, or it is dry. The patient's hair is, her hair is clean and it is not dry, it is soft, which means she is hydrated. So the next assessment that I'm going to perform is the skin assessment. In doing the skin assessment, we should inspect and palpate the skin. In inspecting, it involves looking the general skin color variation, skin integrity, and lesions. When palpating, it is important to note the texture of the skin, the thickness, the moisture, and each temperature. So, can you hold this one, please? Now, look generally at your patient. Look for any color and pigmentation of your patient's skin. So far, her skin is great. I don't see any colors or pigmentation here, but she has moles. If you saw any pigmentations, we should measure it with the use of ruler. Determine and document what type of lesion, its size or shape, or also its color. So since my patient I don't have any pigmentation here, she is fine. Check also the patient's neck to see if she has any color changes or any pigmentation. Shoulders, none. And the back of your patient. So far, my patients have only moles. She doesn't have any pigmentation. After checking the patient's skin or after looking any pigmentation, we should also check the skin's temperature. So by checking the temperature of my patient's skin by the use of the back of your hand, you should tap it over here in the deltoid muscle, down to the back of the patient's hand. My patient here is warm, which is a good sign. Also check the patient's leg temperature. Can you over here, down to her knees. It is warm, which is a normal temperature, which is good. Next is, we should also check the patient's mobility and skin texture to know if the patient is hydrated or dehydrated. In doing that, we should pinch the skin of the clavicle part or its collarbone. It is hydrated if it pulls back, or it is elastic like that. If it is tightening over the patient's clavicle, it's a sign of dehydration and we should be concerned about that. Here, my patient has a good skin texture, which means she is hydrated. The last assessment that I'm going to perform is the nail assessment. The first thing that we're going to do is to check the patient's hygiene, if the nails are clean or not. Look at the shape of the patient's nails. We don't want any clubbing on the nails. Look also if the nails are rich or are they broken. So this is how you know if the nails are healthy. You should pinch. Like, can you see the white thing? It is called capillary refill. After pressing it, observe if it lasted for less than 2 to 3 seconds to refill, which meant that it's healthy. Over here, my patient's nails look good and her nails are healthy. I think that's it for today and I hope you learned something. Thank you for watching.